everyone, this is Dr. Shayna, Physiotherapist at Amandeep Hospital. Today I'm going to discuss about tennis elbow. Now what is tennis elbow? Tennis elbow is also known as lateral epicondylitis. Lateral means the structure which are present on the outside, and epicondyle is the distal portion of the humerus, and itis word is for inflammation. So inflammation of lateral epicondyle is known as lateral epicondylitis. It is the most overused syndrome of the elbow, that is the injury to the extensor carpi radialis brevis muscle which helps in extension, मतलब इसको सीधा करने में help करता है, उस muscle की overuse injury की वजह से जो होता है, that is called as tennis elbow. Now what are the causes of it? The cause is overuse injury. It is due to the repetitive action of the wrist extension and the pronation and supination. The symptoms which would be present is basically the pain on the lateral epicondyle of the region. Pain अब radiate कर सकती है ऊपर भी. It can also radiate to the lateral side, मतलब outside of the forearm. Second is gripping action जो है वो reduce हो जाएगा. Third, जो extension की strength है वो कम हो जाएगी. Now, you must be wondering that if it is called as tennis elbow, so it is mostly seen in tennis players. No, only 5% of tennis players are there who are actually involved in tennis elbow. Other than this, it is commonly seen in the computer workers who are in the typing job and repetitive wrist extension is there. Then it can be seen in the badminton players, the squash players who are doing this repetitive wrist extension. And other than this, the household ladies who are involved in washing of the clothes. Now, I would like to discuss about the management. The first is conservative management. Conservative management would include ice pack, that is for 3 times a day for 15 minutes. Then second is you can use the ultrasound, which is a very common modality used in the tennis elbow, and it will involve the intensity uses 0.8 watt per centimeter square for 7 minutes of duration. Today, physiotherapists usually also recommend phonophoresis, which is mixing of the drug, that is usually ibuprofen, with the ultrasound gel, which is used for the pain relief. Other than ultrasound, we can use the TENS also for the pain relief. Now, what would be the exercises which are very beneficial for the tennis elbow? First is range of motion exercise. You can ask the patient to keep the supported forearm and then perform this wrist flexion and extension. This is ROM exercise. Then pronation and supination, which is this action. And then you can progress to the stretching exercise. Ask the patient to keep the forearm in extended position, pronate the elbow, that is palm facing downward, and stretch it in the downward position. Keep this hold for 30 seconds. The third exercise is strengthening exercise, which we usually progress from ROM exercise to the strengthening exercise. The strengthening exercise can be used, like you can use a weight cuff for the strengthening purpose. Ask the patient to again perform the wrist flexion and extension by using a weight cuff. Then pronation and supination. Other than this, physiotherapists are today also using this taping. The tape is very beneficial in case of tennis elbow. Deep transverse friction massage can also be used, which is basically pointing at the same point and produces an analgesic effect. Thank you.